Well, thanks to all the presenters, great presentations, and again, a slate of really wonderful questions as well. So thanks to all of you who put those in the chat box. Next thing we're going to do is I'm going to talk just a little bit about the care navigation program that Lee Health and Kids Minds Matter has stood up recently. I have to say this is a really important and near and dear heart event for me. When I first got down here from Boston, I met with Lori Brooks. Everybody knows Lori. She's the Director of Mental Health Services for Lee County Public Schools. And I asked her one question, which was, if we could do one thing for you, what would that be? And she said, we need care navigators. Now, care navigators are best thought about as like peer specialists. These are people who have lived experience with mental illness, who have successfully navigated through the system and through their families' difficulties with mental illness, and have done so either locally or in other places. So on hearing that, what we decided to do was to build an initiative with Lee and Collier Schools, Kids Minds Matter, Suncoast Credit Union, and with the help of a few other private donors, we have gotten about $750,000 for this program. And so we have been able to stand up a number of care navigators, both in Lee and Collier County. And so it gives me great pleasure to ask Lorena to come and introduce her team, at least some members of it, and talk a little bit about this amazing project that we have ongoing. Lorena?
Good morning again. So our Kids Minds Matter Mental Health Navigator program is uses a team-based collaborative planning process to actively engage parents in developing a care plan for their child who is coping with mental health and behavioral challenges. It is through that process that parents become involved in accessing resources to also address their basic needs. So it's, like Dr. Samiani said, it's a collaborative effort between the Lee and Collier County school districts, healthcare providers, and other agencies in the community. It is based on the SAMHSA system of care model. What makes it very effective is that our mental health navigators are experienced family members of individuals with serious emotional disturbances. So they provide this peer mentoring, and they really can connect to our parents who are going through very similar struggles that they did when they were dealing with their own family members. So the mental navigators can have up to 8 to 10 families. They are embedded within the school systems. And their goal really is to teach families to utilize the resources to advocate for their children. And the goal is that they will be able to do that without much help once they graduate from the program. So to speak a little bit more about this, we have 2 of our mental health navigators here today. And so I will pass it on to Joseph Craig, one of our mental health navigators, who will be talking a little bit more about the program.
Good morning. Another special concept of the mental health navigation program is what we call the Child and Family Team Meeting. It is one of the essential components of the program that separates us from other programs to be effective. And what that is a Child and Family Team Meeting brings all those supports that have been working with a particular family under one meeting. And with the parents present, we discuss specific tasks, assigns tasks to each one of the support services, and establish deadlines for each task. We identify potential barriers and needs from the perspective of more than one service provider involved with the family. It empowers each participant to be a stakeholder in the family stabilization on a bi-monthly or monthly basis. The Child and Family Team Meeting gives the team the opportunity to reach out to those who may not traditionally be brought in on as family stakeholders, such as aunts, uncles, cousins, friends, people that, bus drivers, whatever may be having a direct impact on the family, we bring them under this one meeting. And part of the reason for that is not only to provide different perspectives on issues that we need to resolve, but also it develops a separate independent support system that the family can rely on after our program is finished. The team strives for consensus of members in deciding what measures need to be taken care of to address a particular issue or issues. By encouraging participation of the family's personal circle of supports to participate in CFTM, it may open up non-traditional and creative ways to resolve issues that maybe traditional support services haven't come up with. The CFTM, which is a child family team meeting, is also used in deciding how to use flexible wraparound funds to address financial shortfalls that may have impacts on a child's performance in school. The team develops financial plans with the family for long-term sustainability and within the family system. The Child and Family Team meeting puts in place a practical way to follow the concept that it takes a village to raise a child. Since March of this year, the CFTMs have been used to help the child's performance in behavior and attendance in school, and we have seen dramatic positive impacts on grades and attendance, as well as behavior in the home. The children being seen by our program have improved in grade performance, averaging 63.5% in language arts before the program started, and ending the year with an average of 78% as a final grade, making a 15% improvement performance in just one quarter. For math, the average grade before the program began was 67% after the program started. The final quarter had an average of 79%, of making a 12% improvement in math across the board. With regard to attendance, according to our latest report, students in our program went from only 10% having perfect attendance to 55% having perfect attendance, and there was a general improvement of 15% in attendance. To explain a little bit further about our program, I want to hand it over to my partner, Janine Sparks, who is also working in Lee County as a mental health navigator. Thank you.
Good morning. As Joe said, my name is Janine Sparks, and I am a mental health navigator working with students in the Lee County school system. So I want to talk a little bit about where our referrals come from and about our wraparound approach to providing services. Our referrals come from the school mental health teams. We get our kids recommended to us by the school. The school mental health team includes the counselor, social worker, psychologist, and nurse, sometimes the behavior specialist or an administrator. They are kids who are struggling in multiple areas, behavior, attendance, and course performance, or some combination of those factors. And they have not been able to respond to typical school-based interventions. So all the usual things that this school can do with them have not produced results. Schools or students referred to our program are usually those cases where the school and the family can't close that gap between what the student needs and what the school and family can do without outside assistance. And that's where we come in. As navigators, we provide that outside assistance, and we use, like I said, a wraparound approach. So what is wraparound? Wraparound is an individualized approach to supporting children and families with complex needs. It is child-centered and family-focused. We don't, one of our kind of guidelines that we use is not about us without us. So we do everything with the family. They are involved in every decision that is made through those child and family teams that Joe talked about. We look for the specific needs of each child and each family and what the barriers are that are preventing those needs from being met. And then we try to reduce those barriers, help the family meet the needs. Wraparound approach is a team approach in which we try to support and empower the family to meet the needs of their children. It is strengths-based, and it's focused on outcomes. And so we give the family a voice in every decision that's made. We use the SAMHSA Systems of Care model, and so it lists the key aspects of wraparound as being a team approach, using natural and community supports. Decisions are driven by strengths and are, like I said, family focused. They're based on the specific needs of that child and that family. They are outcomes based, and they're built towards sustainability for the family, because at some point we're going to step out. You know, when the family is more stable and they are able to address their own needs, we're going to gradually, you know, taper out of their involvement, and we're going to let them, you know, continue on their own, and that's the goal. So, examples of wraparound services that we have used in the last 9 months are connecting kids and parents to mental health services, providing transportation, helping complete applications for things like housing, financial assistance, or school enrollment this fall, you know, when they had to choose between Home Connect and face-to-face school, helping families access food resources, literally anything that helps increase the family's access to services and resources, and to help the child and the family function in a more healthy way. We've connected families to donated beds, sent kids to day camp, provided for emergency groceries and car repairs, bought school clothes, helped clients prepare for their driver's license test, and driven clients to medical appointments, whatever the pressing need the family has. Mental health navigators and child and family teams develop that support system for the family to help make sure they're stable and resilient and they can meet their challenges when, you know, once they've graduated still from the program. I want to share a real quick success story with you. It's the story of a young man that I'm just going to call B. He's in 4th grade, and he's struggled with learning and behavior for many years, since pre-K. His family's faced a lot of struggles over the last year, including homelessness, the death of several relatives from COVID and not from COVID, loss of contact with their dad, and loss of dad's income, and loss of the family car. So they've had a hard time. We've been able to work with local agencies to provide them with beds for 5 children. We've gotten new school clothes to replace some of the ones they've outgrown. And we've provided them assistance with the broken car. And we've helped mom to continue the youngest ones in childcare, you know, after, you know, her funding ran out. But more importantly, we've been able to partner with the school to find him a classroom where he can be comfortable and do his work. And we have begun the assessment process to find out why the traditional supports for students with learning problems have not worked for him. Because he's had an IEP since he was 5, and he's 10 now, and he's still struggling every single day. So we're in the process of getting him some specialized therapy to meet his needs, since what's been happening has not been meeting his needs. We're working with mom and the school to see if we can get his younger brother, who's just started kindergarten but is showing a lot of the same problems, trying to get some early intervention involved there so that he doesn't have to go on until he's 10 years old before he gets help. So I want to just close with a quote from Mr. Rogers. Okay, we all know Mr. Rogers. And this quote really says a lot about our program. We live in a world in which we need to share the responsibility. It's easy to say, it's not my child, it's not my community, it's not my world, it's not my problem. Then there are those of us who see the need and respond. And I consider those people my heroes. And everybody today fits in that category. And I want to thank you all.